And we're live. Hi, good morning, guys. Good to see you both again.
Good to see you.
And Tom is inside today because it is raining. It's also raining in Jersey. Danielle, is it raining by you today?
Nope.
It's not raining by you, but it's like 6 miles away.
Yeah.
Yeah, that's not fair. What's up with that?
I don't know.
How it is on Belterre?
Yeah, it's wet outside.
So this morning we are talking about issues after explant. So I'm going to go and see if we've got any comments yet. Oh, we have a hello. So we have some listeners.
Hi.
Lori. And my comments are coming up today, so that's exciting.
Yeah, I would wonder, like the people who are listening, have you explanted? Do you have implants? What are your where are you at in life with those?
Good morning, Kelly. So yeah, I know that we do have ladies on who have explanted so far.
Oh, hey, Melissa.
Oh, is there a live comments thing over here?
Oh, I think Danielle's looking at her meeting.
Oh, I should do this just because I don't know if people want
to. I can see it.
No, but I didn't know if people, like, just for HIPAA, and I don't know if people want to, let's keep, if you guys want to be, if you want us to mention your name, just say so. That's fine. But I like to keep things confidential if possible.
I agree. So we have Lori who's waiting for explant the end of June. I know Kelly we have who has already explanted. So we do have both. We have ladies who are waiting and we have ladies who have already explanted.
Mm-hmm.
Great.
So
hey, Roxanne.
I want to start with what we were just discussing before we went live, which one of the questions that comes up so often in our groups is, why does everything happen to us on the left side? Our pain,
right.
And all of that. I want Tom and Danielle to explain maybe a little bit about why the left all the time.
So, well, before Tom dives in, it's not always the left.
Not always. So often when
there
say,
is
"Oh,
no always."
God,
There, but however,
well, I just didn't want people to think
it's weird if it's not the left.
Well, not only that it's not weird, but people present differently depending on where the implant is placed, depending on the type of implant, depending on the chemical. Like, there are a lot of variables. We know anatomically what you're about to say, right? But
yeah,
it's never always. And the bigger thing is, I don't want people to be left with, hey, it's on the right, it's not my breast implants, right? So I just want to be careful in our language, and and it's not definitive if it's left side. Like, I have clients who have autoimmune that it's left side because of anatomical structures. So I just want to be, I'm the church lady or whatever. Just want to be careful.
True, but there's a lot of anatomical variants as well.
Yeah.
So,
and if it is the left side, Tara, like, this is why.
There you go. If it is left.
So often there's a left-sided issue, and it's and what I think that's coming from is how we're built on the inside. On the outside we look very symmetrical, and on the inside we're not very symmetrical as far as how our organs are positioned. And there's lots of variances even in where nerves run, how the lymphatic vessels flow, or where they're located, and that kind of thing. When you have the implant underneath the right side and the left side, okay, so if it's under the left side, you'll have, it's more possible to have lymphatic issues because that is where the main thoracic duct usually comes is onto the left side up underneath the clavicle. So there's more of a chance for there to be congestion, because when the implant is stretching out that muscle, it can change, or it can occlude the lymphatic vessels that go through head major and are trying to get to that area on the left side.
I did a post regarding the thoracic outlet in that area. I'll try to find that so we can call that up, Tara, just to can we call that up here? Next time we can. Sorry, Tom.
Are you muted? You're muted over here.
Oh, Tara, you're muted. Oh.
There we go.
I'll try to see if I can call it up.
Not that technical yet. You can share if you can figure out. You can absolutely screen share if you can figure out how to do it. You're more than welcome to pull that up. Absolutely.
Okay. So that's one of the reasons why you get, I think, a lot of issues on the left side in the chest and below the clavicle area, and on the right side, the vagus nerve, which is a nerve in the body that is kind of part of our internal alarm system. It is what helps govern our fight, flight, and freeze response. So if you get startled, or if you feel like you were in danger, or if you have some sort of trauma, that is the nerve that reacts. So on the right side of the body, inside the ear, and through here where the vagus nerve runs, it's a cranial nerve, so it comes out of, that means it comes out of the brain, it comes out of the cranium, and comes in through here, and it touches on the inside of the ear in a few places, and it comes down through underneath this big meaty muscle right here, and then goes down to through the torso, and then talks to all of your organs. On the right side, it has more communication than on the left side. There's more things that it talks to. So there's more of an opportunity for there to be a reaction for trauma on the inside of the ear or inside of the jaw. So I think a lot of the right-sided upper jaw, and you could slice this 100 different ways really, and talk about it in lots of different ways, as far as even skull shape, bone positions, things like that, as far as the jaw and ear and things like that. But I think if you look at breast implants from a trauma lens, then you'll see that's one of the reasons you get like right jaw, right ear, that kind of thing, because I see that often too.
Yes, I had that as well, and it was constant, and it was very painful. I know a lot of women talk about the jaw pain and all of that. I definitely felt it on both sides, but a lot of times more on my right. So very interesting to me, all of that. So thank you for that, Tom. Awesome.
And I don't want to present those as like things that have been double blind studied. Those are, clinical findings. They're observations.
Anecdotal
observations. Like I see that kind of stuff often. So.
Yeah. Well, I mean, experience is huge, and a lot of women with what they've been through, and same with Danielle. So I think that just speaks a lot. So thank you. If anybody else has any other questions about issues that have arose for you after explant, feel free to ask in the comments. And or if you're waiting on explant and you're concerned about anything that might occur, please go ahead and ask in the comments. Danielle, did you have any luck on that?
No, I'm frozen, but I can find it via Instagram. So
did you have any more comments, Danielle, on the like right-sided jaw, ear, and the vagus innervation? You and I haven't really talked about that, and I'd like to know if you.
Yeah, I didn't.
Things or.
I didn't. My My experience is not on the right side. My issues were mostly left-sided. And so there's distinctions that hopefully over this next year we can make between the physical, the emotional, and the physiological impact of the implants,
Right.
and how they affect the head, the neck, and the torso. So, you are in Charlotte, and there's X number of physicians who implant in Charlotte.
Mm-hmm.
And I mean, I know you get other people from other states and things like that come in, or, they didn't get implanted in Charlotte, but,
right.
We are a microcosm of what could happen and who we see. And I think that when we have the implants in, sometimes the biggest or the loudest or the most painful thing might present itself like, oh, like for me, it was my left side, right? But that doesn't mean my right side was also affected. I just wanted you to take care of my left side quickly. So there's, there's a lot more than just the anecdotal. And for me, with you, like, you helped me with my greatest pain, and then we would always dig to the next thing or the next thing or the next thing. So, but I think at the end of the day, we're feeling the symptoms of, or the effects of, a cascade of things. So even if we were to take care of the pain, which was so helpful, there are other things to mitigate. So I think what you said was totally dead on. And I think my stand for all of this is like, it's not just that, right?
Yeah, it isn't just one thing.
So I know that doesn't specifically answer what you just asked, but.
Well, getting back to, thank you for that response. So I think one of the things that I also see post-surgically is a lot of questions about numbness in places that is more like when you have, it's more peripheral, it's more on the skin numbness. When will I get feeling back? That sort of thing, which I think is, it's something to talk about, because the answer is going to be really mixed on this, because you'll have people are going to have different ways that their body knits back together. So, and the way that the nerves are trying to come back together, and there are lymphatic issues or fluid dynamic issues that are causing numbness, as well as just the fact that the nerves aren't, they're not done. They're not done healing.
Or the postural strain of the hypervigilance that we have, right? So there's patterns involved as well. Like, at least for me in my experience, which I really can only, speak from. So even if you open up all those conduits and those lines, one still might have numbness because those nerves were cut in a certain way that, we can talk axons, dendrites, and that kind of thing. But yeah.
So yeah,
I feel like a downer. I feel like Debbie Downer today. Yeah.
Well, I mean, I think there are some postural things that are involved, and those can be involved whether someone has explanted or not, where you can have numbness around an incision. I mean, there's when you have a lollipop scar, where you have the incision that's around the nipple that comes, and then the line that comes down from that. You'll see a lot of folks where they've done, let's say, a lift from the inside of the nipple. So there'll be like a skin flap that they've created there to lift up the tissue.
Yeah,
And
that's always the trouble area.
what's that?
It's always the trouble area for women with the lift.
Yeah, I'm sorry, you broke up. It's always the trouble area of the what?
Always the trouble area for women who have had a lift.
Right. Yeah. So, and I've tried to help lots of women with some of that, and sometimes it's successful and sometimes it isn't. And I still feel like I'm trying to sort out why, and why is it helping some people? Why is it not helping others? Sometimes it's maybe they're just not done healing in that area. I mean, I've seen surgical scars that have taken, more than a couple of years to where the feeling comes back, even if you get work done on them regularly to try to help the body heal in that area, whether it's lymphatic work or vascular work or nerve work or something like that, neural tension that can keep that feeling from coming back. There's sometimes you'll see it structurally though too. So let's say if you'll have numbness that maybe goes down your arm afterwards. Maybe your body reacted in a particular way post-surgically that caused muscle tension. And sometimes it's hard to sort out what that source is coming from. Like, why did that happen? And for a lot of women, let's say if they have the numbness that's down the arm going towards the pinky, and if they look themselves in the mirror and they notice that arm, that shoulder up is lower on that side than the other side, and they feel that numbness on the side that is low, they'll have this tendency to want to pull their neck up like this because they'll feel so much tension in between their neck and their shoulder. And one of the things that I think is happening is there's a reflex in the body where this lat is the lat, which is this big meaty muscle that runs down the side of the body here, is tensing up and pulling the shoulder down because of the trauma or for whatever reason. Not exactly sure. But it seems that you would want to work on the neck because that's in the top of the shoulder because that's where a lot of the pain's coming from, but really the shoulder needs to go upwards. So getting your side body here loose from either a foam roller or something else can be something that can really help your shoulder and neck and head and all those things. Was that really vague?
No, that's good. That was, I think rolling is huge. I think rolling is a great technique for helping a lot of what we go through.
And when I try to instruct people on how to roll, let's say if they were going through on the right side of their body, and if they just place the foam roller on the lat, this big meaty area here, and just lay there, and sometimes you can't straighten your arm out or lift it up like that, so you have to drape your arm over and just compress that muscle and allow it to relax, because rolling back and forth isn't that's not how I teach people, though that's a valid way to teach it, but I don't think that that's the most helpful, especially in this sort of when someone's in this sort of condition. But when you get back up afterwards, and you could look at yourself in the shoulders and see if that shoulder raised up some for you, and you'll know you made some good change.
How about a tennis ball? Do you ever use like a tennis ball as well to get in the area?
That hurts more, but yeah.
I feel like tennis balls are too specific.
Okay.
And the body likes big, broad pressure more than it likes specific pressure when it comes to like a muscle like the lat that's totally compressed. So that big, broad pressure into that muscle is going to make the nervous system relax more. And a tennis ball is more, or a lacrosse ball is more specific and more of like a neuromuscular, like let's try to rub something out. But I don't think that's always the best way to think about it, is to try to rub something out. Think about
Yeah.
it.
Okay.
And sharing my experience with foam roller, Tara, and Tom, when your lymph is congested, it hurts so bad that and I know I wanted to have relief so bad that I would roll through that pain.
Right.
That is not the end game. And if you have that pain, there's some lymph work to do first, and that might relieve everything. So,
Okay. So can I get to a question then?
yeah, because I can't see them. If
Okay.
people, can I?
They're coming.
So if people want to go on that Instagram or Facebook to see what Tom was just talking about, the PEC and the PEC minor, PEC major, they can go there so we can at least give them something to learn. And then now let's definitely go to the questions.
And where is that, Danielle?
Oh, on Navwell. And I can forward them to Tom. Yeah. And you.
Okay. Okay, perfect. Or we could have you post it here in the comments on the.
Yeah.
Okay.
Definitely.
So, not Melissa. Sorry. There was, oh my goodness. Where did it go? Yes. Can you guys show an example of how to do a lymphatic massage?
Sure. Okay. So if you're listening to this, I want you to take your forearm, like putting my forearm up, or take your hand like this, and I want you to take your finger and put it right in the middle of the palm of your hand. And I want you to just stretch that skin there without pressing into it. So don't press in and push down. Just go a little bit like the depth of maybe a dime, if you can imagine the width of a dime, and go about that amount of depth and try to stretch that skin. You can do it on the back of your hand too. And I want to do this as an example just to kind of get people to understand palpation and what they're feeling for in their body. Because
to be able to slide the dime. Let me go get one.
Yeah. If you sliding the skin here, I don't know if you can exactly see what I'm doing here, but I'm taking just a little bit of skin on the surface of my hand here or on the palm, and I'm just stretching it and letting it go. So, okay. So, and I wanted to demonstrate that just kind of so everybody understands how they need to touch themselves, because we do have a tendency to want to get things moving and press real hard and stuff like that. That doesn't work. The body does not react to that. The body has to be, there's very specific touch that moves the water in the body, and it's very light. So when it comes to the chest, everything inside the breast tissue, with the exception of a little bit right here, is going to go right straight into your armpit, all of this lymphatic fluid here. So a lot of folks, and the same thing with underneath the arm here. So if you take your hand and you cup it just a little bit, almost in this little C shape, and you place it underneath your armpit very softly, and just pump slightly, pushing in. So I'm pushing the direction this way towards the inside of my clavicle. This can start to help clear and open up the passageways of the lymph in the breast and in the side body to go into get drained back into the lymphatic system. And you can do that on obviously both sides. And it's going to take a little bit of practice and a little bit of awareness as far as how hard you're pressing. But when you feel water moving and you feel like you're pushing fluid, without pushing muscle. It'll be just a little bit different. That will be one of the things that'll start to help clear. So that's a good. We have a dime. Is that dime? And you're pressing it underneath. You're pushing it underneath like that. That's good, yeah.
So if I push too hard, I can't move it and I'm gonna strain. So it's literally just trying to move it back and forth. And really, you can't mess it up. I mean, I think even if the bigger thing for me is no pain, right? Like we want to teach ourselves what the edge is, and pain means be more gentle. And pain, maybe tap, maybe, like we can't get it wrong. Even if you just tapped under here, you're going to be sending signals. And I think we're so inflamed on the inside with BII that we're trying to get things fluid. We're trying to decrease the inflammation. I think just moving, walking, breathing is great. And when you can get to doing this massage towards the clavicle, like even if you press too hard, if you're feeling pain, that's too much. That's not going to give you a yield that you want. But if you can back off and lighten up, even if it's not like on the lymph level, like a trained practitioner like Tom is, you're still doing something and it's still good. It's still good work. Would you say, Tom?
Yeah. It's kind of one of those things where you can only be more effective.
Yeah.
So you're not going to really screw it up unless you're digging into yourself.
Tom, I'm curious about moving the lymph, like in this area.
Yeah. So this area here is super important. So if you look at your clavicles right through here, right through the middle, and if you move your fingers towards from the clavicles, move it towards the center, then you're going to run into those muscles. You feel those two muscles right here.
Mm-hmm.
So right underneath those muscles is where you're going to try to target at the very beginning to try to help get fluid moving. And you want to use the same. So don't do this in public where people think you're choking. International choking symbol.
But even remember, we're not you. Well, I might be. I'm just kidding. But you could even just tap here, just very lightly tap. I don't even know if you can hear the sound that we're making, right? And you can't. So just lightly tap, like you got little wings, like little butterfly wings. You could even just tap here, right? And then, if you can feel a distinction, like this was really tight before I just did my little butterfly wings. And then I'm ready to do the milking I think Tom was going to show. And then like Tom, like we were discussing before, like the more you can do the Tom, the more you can do a trained lymphatic drainage, the better. Like, so if you can go get a lymphatic drainage, therapy session, then great. And then this is how you can maintain till your next. But I apologize for interrupting. And
no.
I would love to teach practitioners how to do all this or to do it on their clients. But I think a lot of people that are listening are like me, or like lymph, muscle. What's that? So,
yeah.
So please continue, because like you just worked on me the other day, and you did like I had so much tension in my occiput area here that I know when I get a little brain fog that this needs to drain, but I couldn't open up myself. So I went to see Tom. He has special privileges. We should probably mention that because I don't want to get you in trouble. But
special privileges for working right now. Yeah.
Yeah, and I'm post-surgery, so he was able to help drain this whole area by what you were just showing us. So
Yeah, but interestingly enough, also a lot of the pain that you had, if we could talk about that briefly, if you're okay with that.
Yeah,
The back of your
totally.
head, that was a lot of it was coming from your abdomen. You'll have congestion in the abdomen that's lymphatic congestion.
Yeah.
And once we got a lot of things moving down there,
So, just to share with people, I explanted in like 2.5 years ago, October, had fat transfer, and that 3 months later in January. And apparently I've been carrying around a seroma under the left pec, which is actually what they call a pseudobursa that adhered to the chest wall, the pec minor, the pec major. And so I had no movement, well, restricted movement on the left side, and I had some issues there. And it's been about a month now that they removed it, and I'm doing well. And with all the COVID stuff, I haven't been able to get to, have therapy, and finally was able to receive some therapy. And it was a remarkable, like, I feel so much better. I can even breathe better. So I'm a fan.
That's great.
Yeah.
We have another question, a follow-up question. Where exactly under the arm are your fingertips?
Oh, okay. So if you were to take your arms and cup it and pull it up underneath. So,
Wait, how do I do this? It's a sports bra.
So, yeah.
Tom, you could do it. You're a guy. I'm actually a little full.
So, yeah, you go ahead. That's much better. Go ahead.
Does that help people? Can you see? Is there another way to do this?
Well, I'd say put a little bit of slack. Move your elbow down just a little bit so people can see the fact that you're going up underneath that muscle. There you go. Right in through there. There you go.
Look, there's a muscle.
Yeah.
And that's a little too hard, but for exaggeration's sake, right? Remember the dime?
Right, just so you can see it. And if you just pull that skin, and you have to release the skin afterwards.
It's almost like a 1, 2, 3, 4 release. Maybe not a 4, right?
Oh.
Can I ask a question while you're right there, Danielle? I have swollen nodes under here on both sides. So should I be moving across that lymph node?
So if you have swollen nodes, you want to work around the lymph node, and you don't want to squish onto the nodes.
You don't want to press. You literally want to move that dime across. Like, so if I had a wish for everybody, let me think about how to express this. So you're not going to hurt anything. If you have pain, stop, back off, period. Like, if I push and I move this around, that's okay. But my wish for everybody, even those who still have their implants in, is to be connected to their bodies. And there's a distinction between feeling the skin. Am I allowed to do this on Facebook Live? There's a distinction between feeling the skin, and then you can just press just ever so gently, and you can move the skin, right? So I don't know, like, I wish I understood this thing. So I'm pulling the skin versus sliding across the skin. And then I can slide into the muscle, and there's a deeper sensation, and I can feel that that's muscle. And then I can even go, how far can I press some more? Oh, there's bone, right? So practice that. And even if you're just sliding across the skin, that should feel a certain way, right? And then you press just ever so gently just to stretch and recoil, or stretch. And there's like, if people can even take this on as a meditation, there's a feeling there of letting go, right? And if I press too hard and I stretch, it's a But if there's ever so gently, and if you've had lymphatic drainage, there is a zone that, if we continue these, Tara, that I think is important to our healing, because it's a feeling, it's a connectedness, and you will actually feel after a while. And I think that, which is parasympathetic. I mean, I can geek out on you on that, but like that is what we're missing because we're so hypervigilant. We're so tense. We're so this. And what we need to do is not do it. We need to feel it and be it. And you may even cry. I mean, I've cried a few times.
If you feel a sigh come on, or a yawn, or a swallow, those are all indications that you're balancing out your nervous system better and that you're bringing yourself into more of the calm state and out of the hypervigilant state.
And I would even say that if you feel a sense of panic, because we're not there, when you have VII, you're not, that is unfamiliar.
Your audio is freaking out.
Yeah. Your
audio just freaked out.
My audience freaked out?
Yeah, audio.
Okay.
Oh, sorry.
It's back now. But you went all robot for a second.
So the yawn, the this, the that, I don't remember. Remember when we did something and I didn't yawn, I didn't stare. Like we are so, for lack of a better word, uptight or hypervigilance or on fire or in cell danger response that there's sometimes there is access, you guys, to letting go. But it's not like we have it right away. So if you feel a little anxiety just from a little like, oh, this isn't going to do anything, or the dry brushing, or it just makes you feel like a little back off a little bit. But that is what we're looking for. We're not looking for physical pain. We're not looking for mental torture. But this, you might even start to shake on the inside or get cold or, sorry.
That's okay.
No, it's true. Yeah, I think all those things are so great to share.
Let me get dressed.
So we had an interesting question over here about dry eye.
Oh yeah, I wanted to just finish up with the lymph questions first, but I wanted to assure Abby and Melissa that we will get to your questions after. So the last question about lymph was, I have breast implant associated anaplastic large cell lymphoma in my supraclavicle lymph nodes. I hate the tightness and I feel that I'd benefit greatly from the lymphatic massage. Do you think it's safe for me to do?
That's a really good question. And it's not an easy one to answer. Do you want to take it or do you want me to?
No, I'll take it because textbooks and educators and stuff will say, no, if you have lymphoma, no lymphatic massage or drainage therapy, right?
Right.
Stagnation. So I'm just going to give you my belief. Stagnation is, I don't think, ever good, right? Like things that don't have a fluidity to them. There's no studies on what lymphatic drainage therapy can do on Hodgkin's or non-Hodgkin's lymphoma. I think, at least that I know of, and I'll do a search for you. Tara, can you write that down while I'm talking so I don't forget? Because I want to do a literature search. And the risk might, the assumed risk might be too high. So fully informed consent is what I do for clients. And I let them know just this, like everybody tells me don't touch cancer on that side. If you've had lymph node removal on that side, then you might end up with, full edema and things like that. So there's ways with a trained practitioner to work gently. You don't have to work specifically in that area, but you can move, like Tom was saying earlier, like the groin lymph, the under the armpit lymph, and not really even mess with here to relieve, so you can get that fluidity. It's circulation. Lymph needs to circulate. Lymph carries hormones. Lymph carries all these different properties as well as detoxes you, right? It also moves through every organ. So which in my opinion, what we want to do is to continually have that moving, right? Like you don't want to do like a one and done. So, yeah, I mean, this might be controversial, but I say lymph movement is good. You know, sauna is good. You know, get it out. So now I feel at risk here, but I Tom, anything to
add? I mean, yeah, I agreed with all of that. I mean, I think that it's a difficult situation to approach, especially as a practitioner, because there's a certain amount of liability that you don't want to take on, but there's also, you want to make sure you're caring for people in an appropriate way, which is going to be useful to them, and you kind of have to look at a whole bunch of different angles on it. So you could work on the lymphatic system in somebody's face, chin, hip, abdomen, head, wherever, and help the circulation for the whole entire body. Like you'll work in somebody, you know, I'll find that when I'll work in somebody's head or neck, sometimes they'll feel it in their abdomen or their hip or, you know, somewhere else.
So I have a couple of clients, or well, actually one, it was Tara, it was at the FDA convention. I would say her first name was Michelle. She might not want everyone to know. And she sprained her ankle, or she might have torn it, and it was so swollen. But we worked just upper body, and that helped her leg or her ankle.
Yeah.
You know, so there are things we can do that isn't right on that area. And but I do believe that lymphatic drainage is good and positive for everybody. I think the old time fear and the lack of evidence-based medicine and studies make it a challenge to, you know, have the educators out there say, do this, it will be helpful, right? But if you find a path or a functional medicine provider, they're going to find a way to help you move that lymph and detox and things like that. So I hope that answers your question.
Thank you, guys. So getting to another question here. Coming up 1 year since explant. Can you hear me okay?
Are you talking about the say that again? Are you talking about Kimberly's question or whose question?
Abby, with the creases on both breasts.
Oh, yeah.
Anything to get the creases to go away completely.
So Tom, how are you seeing Abby's question? I don't see Abby's question.
So you see where it says private chat and live comments? Up to the right.
Oh, yeah.
Click on live comments.
It doesn't. Oh, there we go.
So she's asking about creases underneath the breasts, which I'll see happen, you know, often after some sort of breast surgery, whether it's explant or something else, where there's removal of tissue. And, you know, there's lots of different approaches, I think, from even just a thought perspective on this. I've seen a lot of, I've seen a few, actually I shouldn't say a lot, I've seen a few plastic surgeons look at it as this tissue is stuck down and needs to be pulled out. I'm not sure if that's the best way for some folks, and sometimes it is the best way for some folks. I've seen, and I don't personally do that. My dog's barking at me.
But we just see the tail following the ears.
Yeah. Hold on, let me get him outside. Sorry, he's just gonna bark the whole time.
Abby, I'd be curious to see if where, so sometimes, like, I don't know, well, one of the questions I would have is, you had explant, the scar tissue may now appear lower. I don't know if you've had fat transfer or a lift,
Right.
or where like, how many access points do you have? And there's also, for me, that's where I get a lot of congestion, especially on the right side. That's when I know I need help with lymphatic drainage, when underneath my right breast gets very full and very sore and tender. So I think there's, we could generally speak, but knowing exactly what you've had done thus far could help with understanding the mitigation. And that begs for the conversation around cupping. Maybe that's another. Right. And I'm not a fan right over the muscle, because depending on how strong that cup is, like if you can move the dime with your cupping mechanisms versus the suction machine, then we're in the same conversation. But if you're sucking too hard with a suction vac or a vacuum, not your vacuum, but like
Dyson.
Yeah, exactly. You don't want to use a Dyson for this.
That was a joke.
That's a whole different conversation. And I just wanted to acknowledge we're 46 minutes in, and we could talk all day. Do you guys want more of this, or
I think is another good topic.
And there are things that you can do at home, but there is. Abby, there is more conversation around that. I don't know where you live. I don't know if you want to PM Tom or Tara or myself to, further give you a general explanation unless we see you in person too.
Yeah, she remessaged and said no fat transfer or lift, and same incision at explant as with implant.
Yeah, so I would assume, you don't have to show us, it's awkwardly lower than we thought it would be. And I don't know what size your implants were either, or what size you began to start, or what you have left with. But so right. I would it's definitely a scar tissue area that can be addressed. And for me, the scar tissue areas under certain stressors, postural strains, emotional stress, that's where the congestion's gonna show up for me first, right? So I know if I'm eating bad, or I'm under a lot of COVID stress or whatever, underneath my right breast is going to get really full.
I think one of the good things, though, as far as what you were saying earlier, is that they seem to be getting better. So even though hers seem to be getting better, so maybe they're filling in like they need to, or the tissue is changing like it needs to. I don't know how long ago
Do you massage it, Abby? Do you work it? Do you have someone work it for you, or do you work the scar tissue? Question mark. Because there's that as well. And then I'm also curious, like, what your diet is. That could help it immensely. So, and then if you've ever done like a biofilm disruptor or seraptase and that kind of thing.
She has not done work on her own. Oh wait, nope, that's not her. Never mind.
She says, I have done.
Yeah, that was her, Abby. Oh, I've done some work on my own.
2 comments came in at she has done.
So someone asked, how often do you do that sort of lymphatic drainage massage type of stuff? And you can do it really as often as you want to, I think. If you go see a practitioner, I think that maybe once a week can be helpful, or even once every 2 weeks can be helpful. Sometimes if you see somebody who knows how to get things flowing like they do or like they should, it's better to let that flow keep happening and let the body learn where it needs to go for a while so the nervous system can integrate the work. And I think that gives the body a better chance to get on the right track. So I err on the side of undertreatment, I think, sometimes, more than overtreatment when I'm treating someone. But as far as and that's just because I want the body to take over. I want the body to do what it needs to do to heal itself. So
yeah,
so
and I disagree.
And you disagree?
I think when you're congested, let's keep it open and figure. You know, it's a luxury to be able to go to a lymph drainage therapist, especially in the COVID times, right? Like if you can find one, keep one. But my goal when I see clients, whether it's to get them in parasympathetic, increase that, decrease the sympathetic, like that's the bigger thing. Like, what are your stressors, blah, blah, blah. So there's a lot of work to do. And I would love to see you. Like I had some clients at the beginning who've had, like say tummy tucks, that the tension, I mean, we carry a lot of emotion and stress in our abdomen, right? So like to keep them open and relaxed, it was, I'd say every other day post-surgery. And then it went to, then it went to every 3 days, and then it went to every week, and then so on and so on. And now they're able to maintain themselves. But when I'm trying to get someone out of an autoimmune symptom response, I want them, and one of my telltale signs is, how is your lymph doing? So if that can stay open and flush, then I know how your diet is, your lifestyle is, or whatever. And we go over all of that together. But like the idea of keeping it open longer is great, but there's a lot of retraining to do, especially in the BII, and especially for me and in the BII population. So it's not just a, physical, keep the lymph open. There's a reason why it's shutting down, and sometimes that's physiologic, sometimes that's emotional, sometimes that's, different kind of stressors, and sometimes it's purely physical. Like, when you have BIA, ALCL, like there's things to do around that, right? So how do you optimize the system? And so if I had my druthers, I would see you minimally once a week until but if you don't need it, then cancel the appointment and move on. And then it's, not 7 days, maybe it's 8 or 10 or 12, but let's see what that N is. And the goal is to get you to do yourself, have yourself be able to flow fluid,
Hey guys, I have to step out just for a second and check on my little ones.
Yeah, we're gonna wrap up, Tom, soon.
Okay.
The last question we'll answer is: should the lymph massage be done only after explant?
No, before, during, after. Everyone who has implants needs lymphatic drainage therapy. They might not know it, but I think those of you who are waiting, explant, tap your lymph, get that lymph moving, trampoline, breathe, do what you got to do. Like, no, everybody needs it, especially in today's pandemic world. Move that lymph.
Yeah. Deep breathing is another way to move the lymph. So.
All right. Well, thank you guys so much. I think this was incredibly helpful again for all of these. So we'll be back, everybody, to do our next topic. If there's something that you would like us to touch upon, please let us know.
Thank you so much, Tara.
Bye.
Bye.
Bye.